Hi everybody, it's Dr. Newman, board certified plastic surgeon in Manhattan, Long Island, and Westchester. I want to talk a little bit about the fact that I'm just seeing so many patients in my practice now who are people who have lost large amounts of weight, predominantly from weight loss medicines like Ozempic and Wegovy and this class of medicines that now people are taking for weight loss. And a lot of these patients are not losing 5 or 10 pounds. Some of these patients are losing almost the kind of weight that people lost with weight loss surgery in the past. I'm seeing patients who are losing 50, 80, 100, even more pounds from these medicines. So the whole idea of weight loss surgery or plastic surgery after weight loss is really becoming a very common thing, especially in my practice. When it comes to breast surgery, and we'll talk about that, I mean, this is a very large topic, but we could talk about that specifically. It's one of the biggest complaints that patients have. It's either their breasts or their belly that they're complaining about the most. And when I see patients who have lost this kind of weight after using these medicines, the change in their chest is quite a bit different than what you would just typically see after pregnancy. I mean, yes, there's similarities, but it's much more dramatic. And basically what I'm seeing is I'm seeing patients who have lost a lot of volume. Remember, they were heavier. Their breasts were much larger. The breasts had plenty of skin to cover that much larger breast. Now that they've lost that weight, yes, their skin has shrunk down, but not that much. But the amount of volume that they have in their breast, since they have lots of fat in their breast, has shrunk significantly. So I'm seeing people who have lost so much breast volume that they actually need more volume. And at the same time, they have all of that skin from when they were heavier. So their breasts are very empty, their breasts are very low, their breasts are very loose, and most importantly, their chest is very flat towards the top. If you think about the way people like to wear clothing that may be a little bit revealing, it's typically showing the upper inner part of the breast, kind of the cleavage as it goes to the top of the breast. And this is an area where these patients, after all this weight loss, they are completely flat at the top of their breast. So some of this involves doing a breast lift that repositions their natural breast tissue. Some of it involves adding volume so that that volume is behind their natural breast tissue when the breast lift is done, giving them fullness at the top, which their natural breast tissue just won't give them. They don't have enough of it. So it involves these combination procedures that I'm used to doing after people would have changes after pregnancy, but now in a much more dramatic way. In many of these cases, because there's so much skin laxity and there's so many stretch marks on these patients and they have skin elasticity issues, a lot of these patients, I'll even further remove some of their breast tissue and give them back even a larger implant because their muscle can accommodate that, and thereby giving them volume that they're going to keep, and that volume will be higher on their breast, which is really where they need it. Very frequently in these patients, I will add support using what some people will call an internal bra or an internal mesh. And there are several different meshes on the market that help to give some support internally, not externally, but internally, to help that breast lift result last longer. And these are the things that are now becoming commonplace in breast lift surgery as breast lift surgery in these large weight loss patients is evolving. But the end result needs to be a result that's going to be a result that's going to use this skin that's even skin with poor elastic property, but still give people a result that's going to last. And the idea is to give people back a result where their breast is higher on their chest, their breast has a nice shape, and that result is going to last for a while, even or despite the fact that their skin, which gives some support to the breast, has such poor elastic property. I think the internal meshes that we use in these cases, that I use very frequently now, have been a mainstay of helping to give more support to these types of patients. So it's not very unusual for me to be seeing these large weight loss patients, especially nowadays with these medicines that are being used. And the treatment for it is similar to what we would do in the past with people after pregnancy, but it's tweaked a little bit for people who are in this one particular situation where they've lost so much breast volume, yet they have so much skin that's still there. So I hope this conversation is helpful. Again, it's something that I do a lot of in my practice, so it's a common thing that I see here, and I'm happy to answer questions if people have them. Thank you.